Well, good morning and welcome to Great Day Washington. It's time for Medical Hot Topics. Here, we're going to talk with top local experts in the health and medical fields about the latest information that can help your family. I'm joined by two professionals from the Centers for Advanced Orthopedics, podiatrist Dr. Damian Roussel and orthopedic surgeon Dr. Eric Guidy. Welcome to Great Day Washington.
Thank you very much for having us.
Now, as parents are getting ready, you're welcome. Parents are getting ready in Maryland and Virginia to send their students and student athletes back to school. DC is already back to school. I want to start with you, Dr. Guidy. There's a new study that's out that says student athletes are getting younger and female athletes in particular are suffering more injuries. Tell me about that.
Well, you raise a great point. The female athlete, we've noticed over the past 5 years, the incidence of injury of the knee, specifically the anterior cruciate ligament ruptures, is 3 to 4 times more common than their male counterparts. And as we looked at this data, we were trying to figure out what are the differences that are contributing to this. Is it the way that the anatomy is? And that's part of it. There's a very narrow notch in the middle of the knee which can shear the graft. But we found that there were differences, significant differences in strength between the front muscle group, the quadriceps, and the back hamstrings. So the male counterpart had more balance between front and back muscle groups, and the females were relatively weak in the hamstrings.
This is interesting. Now, you mentioned the medical term is ACL injuries.
ACL rupture, correct.
So because of the way female athletes are landing, and we're more competitive than ever before. When I was a student, I always heard of ACL injuries, you know, in professional athletes. But this is happening with women 3 times younger. So how can we protect our children as we're heading back? We're getting into the fall sports season, but a lot of our kids play in the spring as well.
Correct. So one thing we found is very helpful is neuromuscular training, which is really a training program that all female athletes should be involved in for protection of their ACL. And it should focus basically 25 minutes a couple times a week for preseason and throughout the season, maybe a total of 3 months, to work to develop muscle memory and develop landing and jumping techniques as well as strengthening. So we're trying to balance the muscle groups and we're trying to work on agility and balance so they're going to land without the same stress that they would typically have on the knee. And that stress is related to the foot position, the angle of the femur relative to the shin bone below, and there's a lot of factors. But if they do this, we found there's been a 50% reduction in ACL injuries, which is fantastic. So I think all of the female athletes should make this a priority and get involved in a program involving the training.
So the buzzword is prevention by getting that training. And you mentioned the word foot, so I want to turn to Dr. Roussel. You're an expert podiatrist, but there is a high prevalency going around of hand, foot, and mouth disease. I know this from daycare if our viewers have younger kids, because it's common in children under age 5, but we have adults, some Major League Baseball players suffering from this. What is it? Tell the viewers at home what it is, and how is it happening that we're getting more adults getting it?
So hand, foot, and mouth disease is a condition that's caused by viruses. It's generally a group of viruses called enteroviruses. And it's most common among younger patients or children, but adults can get it as well. Generally, once they become infected, they don't immediately show signs or symptoms, but then after 4 or 5 days, they'll start to show some symptoms like fever, fatigue, lethargy, and then it can start to show symptoms such as sores in the mouth and rashes on the hands and the feet. And so commonly they need supportive measures to make them comfortable, especially young children as far as the mouth pain goes. There is no cure for it, but it's generally preventable to some extent by washing your hands. And so we encourage patients to wash their hands.
Can we pause right there? That is a very simple solution. A lot of people, if you're hearing this at home, changing diapers, picking young kids up from daycare, going in, washing your hands before you go in, washing your hands after you leave, that can prevent this viral infection with no cure.
Right, and so you know, we do things to try to make them more comfortable when they're showing symptoms, but hand washing is huge to try to lower the risk. And there's been reports in the media, it's become more popular as far as people becoming aware of it, because there's been 2 major league players that have been sidelined for this, and also some football players from West Virginia. There was a fan day that was canceled because the players were showing symptoms. And so people are becoming more aware of it, and adults can also get it as well. And so sometimes the children will contract it and then pass it along to adults who then start to show symptoms.
This is interesting. We started out the conversation talking about athletes. Well, your student athletes aren't able to compete if they have a disease like hand, foot, and mouth disease, and of course if they don't have that strong muscle built up. So this is really a good conversation. We have 1 minute left in our conversation before we break. Dr. Guidi, can you just give parents the high level, your top tip, piece of advice, one more time for those who are watching and they're gearing up for a competitive back-to-school season?
Well, the data speaks for itself. Of all those ACL injuries in a year, which are 1 to 200,000 in the U.S., most of those injuries occur in women 3 times more at least than men, and women that are under 25. So the data says that the collegiate and professional athlete is aware of some of these issues, but we really need to educate our youth, our middle schoolers and our high schoolers, and get them involved in these neuromuscular training programs, because this has been a great way for us to show that preventative measures have actually worked out to reduce the incidence of injury.
And we're keeping kids healthy.
And that's our goal, is to keep the kids healthy.
That's the goal, right? I read more than 27,000 people participated in that study. That's a huge study.
It's a big study.
So you got to take note of that. Dr. Guidi, thank you. Dr. Roussel, thank you. We're going to hear from both of you a little later in the show. So if you heard something and you want to know a little bit more about it, tweet us, text us, Facebook, and we're going to talk more with these experts coming up on Great Day Washington. For now, we'll be right back.